Hello, my name's Adrian. I'm a plastic surgeon and I'm the surgical director of Aurora Clinics, and we specialise in plastic surgery, particularly cosmetic surgery, and I tend to specialise in breast surgery. So in a previous video I've talked about the tuberous breast, or the constricted breast, or the tubular breast, which is an abnormality you can be born with a very sort of narrow base to the breasts. And I've talked about how that produces an elongated breast with slight doming or herniation of the areola. Now the question is, what's the best treatment for a tuberous breast? And basically the treatment is aimed at stretching the base of the breast, normally by increasing the volume of the breast, stretching the base of the breast and reducing the herniation. So really twofold: increasing the base, but also reducing the elongation of the breast and reducing the prominence of the nipple. Okay, so how do we increase the volume of the breast? Well, basically that's by an implant. Two types of implant. You can either have a tissue expander inserted or just a static implant. A static implant is a one-size implant like we use in breast augmentation. A tissue expander is basically an inflatable implant. So that's put in the tissue underneath the breast and slowly inflated, normally every week, with more fluid to stretch the bottom. Advantages of each. Advantage of the static implant is it's relatively simple, you don't need any other injections. Advantage of the tissue expander is that theoretically you can tend to get, you can stretch the tissue slowly. Okay, so in my practice I tend to use a tissue expander on very severe cases and on less severe cases where I think there's enough breast tissue is soft enough to stretch on its own. I will insert an implant and allow gravity and the implant to do the work. So gravity forces the implant down against the lower skin, which will loosen with time. You can also release that tightness from the inside when you do the breast implant. Okay, so that's the volume aspect addressed. Next we need to talk about how the actual breast is modified, and essentially this is by normally reducing the outer aspect in a donut shape around the areola. Yeah, the areola, that's the brown bit around the nipple, remember, it's normally slightly large. Reducing that and also putting some stitches in across to reduce, to really hold the nipple in, preventing it doming. Okay, so in essence it's a twofold approach, normally to increase the base of the breast, increase the volume of the breast, lower the fold with an implant, and then treat the nipple and the elongation of the breast by tightening up the nipple complex. So it's quite a complex subject. If you think you have got tubular breasts and want to come and discuss it, probably the best to arrange a consultation. I'd be more than happy to talk to you about the best way forward for you. If you'd like to arrange a consultation, I'll do so by contacting us via the website or by phoning us on 01844 214 362. Thank you very much.